All right, good evening, everyone. I'd like to call the May 8th Program and Budget meeting to order. Please silence all cell phones. I'd like to start off by reading our mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. With that, I'll take a motion to adopt the agenda. Motion by Chris, support by Joan. All in favor signify by saying aye. Aye. All opposed? The agenda is adopted. Next is the hearing of the public. Anybody from the public wishing to speak, you have 5 minutes. Anyone from the public? Later? Okay. All right, seeing none, we will close the hearing of the public. We will move on to 4A, request to approve out-of-state travel to Oconomowoc, Wisconsin for the Office of Recipient Rights. How'd I do? All right, I'll take a motion to approve.
Move to approve.
Motion from Joan, support from Selena. Is there anyone here that wants to speak on this?
I'll give a brief update. We do have one facility that's in Wisconsin. It's a specialized residential treatment program for individuals with, it's called Prader-Willi. So we do contract with them, and they're required to have an annual rights review. So we do send folks all the way out to the, I'm not even going to try to say it. To that place in Wisconsin to review that one single site.
Any questions? See, I actually had to say the city for a proper motion, so somebody wasn't just going to Wisconsin. Any questions or comments on this item? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next is item B, board approval of residential lease A. I'll take a motion to approve. Motion by Chris. Support from Ryan. Does anybody have any questions or want? We're on A, Nick. Lease A. Linda? Sorry, TJ, I tried.
Oh, I turned the corner. I couldn't remember why I had it turned down. Now I see. On page 15, on the...
Linda, turn your mic on.
Sorry. It's a memo from Chris in construction at the provider's place. And they said that I have had new windows quoted. I can talk to you about this as we discuss a new lease. Well, this lease is for 3 or 4 years, right?
That's correct.
So they're saying in three or 4 years they'll discuss it?
I spoke with him, I can't remember if it was yesterday or the day before. Today is Wednesday. I spoke with him on Monday, and the windows are on order.
Oh, okay, great.
Is that it?
Yep, that's fine, thank you.
You want me to stay for the remainder of the lease?
Sure. Any other questions on lease A? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next is board approval of residential lease B. I'll take a motion to approve. Motion from Megan. Support from Chris. Any questions or comments on this one? All right, I don't see any. Linda, go ahead.
As I look at these, the amount for insurance given a vulnerable resident seems so low. Does this cover if, like getting people who are in wheelchairs out of a house that's on fire if something happens? That seems like just such low price for insurance, and it's always being lowered or capped.
Yes, you're seeing one of the reasons that is you have homes that have an owner has several homes, so they can get a bulk discount rate. But I can assure you that every home we validate that they have the $1 million coverage and the $500,000. So every year they have to verify that they've not only paid that, but their coverage, it meets the minimum standards of the contract.
Any other questions or comments on this one? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next is item D, board approval of residential lease C. Take a motion to approve. Motion from Nick, support from Joan. Any questions or comments on this one? Linda?
I think this is my last one, but just so you know, I read my packet before I came. I was concerned that it says the front lawn is completely dead and it doesn't look like surrounding homes. That would, that would be a problem if it was next to my house.
It would be, and this was reviewed back in the wintertime, or there was no snow on the ground actually, so it was visible. And now that spring is here, it's actually the time. And I spoke with this particular provider. Under our contract with the provider, they have to have 4 applications of fertilizer per year. They were not doing that. And I have verified that they do have a contract in place this year to bring that lawn back.
Well, so you think fertilizer will bring back dead grass?
I do.
Okay.
It will. It will. Proper watering and fertilizing will repair the lawn.
And is this the one where he wrote you the note that they don't have to fertilize if they don't have to?
No, that's on another lease.
Okay. Thanks, TJ.
Any other questions on lease C? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next is item E, board approval of residential lease D. I'll take a motion to approve. Motion from Ryan, support from Selena. Any questions or comments on D? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Item F, board approval of residential lease E. I'll take a motion to approve. Motion from Joan. Support from Linda. Any questions on E? All right, seeing none. All in favor signify by saying aye. Aye. All opposed? Motion passes. Next is item G, board approval of residential lease F. I'll take a motion to approve. Motion from Nick, support from Chris. Any questions on F? All right, seeing none. All in favor signify by saying aye. Aye. All opposed? Motion passes. And now item H, board approval of residential lease G. I'll take a motion to approve. Motion to approve. Motion from Joan, support from Nick. TJ went and sat down and threw me off. I thought we were done. Any questions or comments on lease G? All right, seeing none. All in favor signify by saying aye. Aye. All opposed? Motion passes. All right, that's the end of the leases. Thanks, TJ. And Tracy. Next is review and approve updated CMH MCO policy 8-008, Behavior Treatment Plan Review Committee, Behavior Treatment Plan Standards. I'll take a motion to approve. Motion from Chris, support from Selena. Fire away.
Hello, everyone. Do we have questions? Would you like me to provide you a summary?
Can you give us just a brief summary?
Sure. So basically, this policy was updated. It was updated probably in August, and now we're updating it again. In August, they had implemented some measures to provide extra oversight to our network. And so there are some things that you will see in this policy that are no longer required as far as the inclusion of the restrictive and intrusive interventions. So after about 6 or 8 months of reviewing that, the committee has decided that that's no longer necessary. So that's really the major change to this policy.
Nick, did you have a question?
Yeah, actually, this question is for all of the policies, kind of. not, the policies themselves looked fine to me. My question is, how do we enforce these policies? They apply to both our own employees, discipline obviously there is controlled by the collective bargaining agreement. They also apply to our contractors. Are they incorporated somehow or referenced in the contract?
Yes, they are. They're in the specialty services contract. They're required to comply with all of our policies.
So if I'm an existing contractor and we change the policy in the middle of the contract,
So I send out a notice of implementation whenever the policies are updated, and it's kind of in a grid form, and it explains the changes just like you get. They get a similar type of a document so that they're aware of it, and then it's provided to the whole provider network and also our internal staff.
and there's a mechanism for them to object, I assume? Because,
They can email me,
okay,
and sometimes they do, or
Okay.
they'll go directly to, if, for example, this policy, they would send any information that they felt like needed to be reviewed to the behavior treatment.
but if
behavior
not, they're
treatment.
contractually bound.
But, I'm sorry, what?
They're contractually bound?
Yes, they are.
And if they violate that, I mean, generally speaking, I say you don't want to impose the death penalty for a parking ticket.
Correct, right.
There's what's the mechanism
Sure.
for enforcement of contractual violations?
So in the contract, there's actually a sanction process, but generally what we do is we provide, training and we provide information and support to that provider so that we can bring them up to the standard where they need to be. So that's what we do first. And then we work with them. If there's continual violations, then we can implement that sanction process. It can require corrective action. Sometimes they just have issues in their workflow, so we'll ask for maybe a root cause analysis. But we try and provide the support that they need and ask the questions that maybe they haven't asked so that they can become compliant with the requirements.
So there's basically a acceleration of discipline, if you will, or sanctions for contractual violations up to and including
Yes.
contract
Termination.
termination. But you don't go, obviously,
No,
okay, you're
we
in breach,
never-
bye-bye, because that
Right.
would affect too many people. We've got all of these things in place.
Right.
Okay, that's very good. The one area, though, then, that kind of, and I'll skip to it unless the chair calls me out of order, is on the provider training issue. If we're training but we're not training, does that create a problem, or we're talking about we're talking about apples and oranges? Never mind, I figured it out.
Okay.
Any other questions on I? No? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next is item J, review and approve updated CMH MCO policies 10-007, direct operated training and development program, and 3-015 network provider training. I'll take a motion to approve. Motion by Joan. Support by Ryan. Nick, do you have a follow-up question for this one, or are you okay? Joan?
Don't we have EMS safety training? Is this the one about EMS safety training, American Safety Health? Aren't they going to train us anymore?
So I think what this says is that they're expanding the types of providers that they'll accept the CPR and first aid training from. So we're expanding that because we're no longer directly going to provide the CPR and first aid training to our network. So we're expanding the types of organizations that will accept that certification from.
Do we pay them?
Do we pay who?
The American Safety and Health Institute,
No.
American Heart Association?
No,
Who do
we
we
wouldn't.
pay?
We wouldn't pay them. So we pay our providers, and then it will be one of their administrative functions to ensure that they train their staff. And because we're no longer providing that training, they'll have to contract with an organization or purchase that service, that training from an organization, in order to obtain that certification.
How come we stopped?
I think that it's a cost issue.
Nick?
So we're sending them to the Heart Association or somebody else to get the training, but we're still requiring them to have that training.
Yes.
And if they don't have that training, you're back to that.
We are.
whole issue of whether or not there's contract compliance? Who monitors to make sure it's happening?
We have our CSI division who monitors training, and then they work in partnership with business management to provide updates.
So we monitor it through our various
Yes,
staff
it's part of one of our
departments.
administrative functions to ensure that they're compliant with their training.
Okay.
Thank you.
Any other questions or comments, Linda?
When we were providing it, were we providing it for free? Were we charging them?
Yes, no, it was provided for free.
So now they have to pay something that's a cost to providers that's new.
Yes, that's correct.
You told us that before, but I just
Yeah.
wanted to, thanks.
Any other questions or comments on this item? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next is item K, review and approve updated CMH MCO policy 10-030. Take a motion to approve. Motion from Linda, support from Selena.
This policy adds a confidentiality agreement so that we can demonstrate if we're ever audited that our staff did understand their confidentiality obligation, and we have documentation to support that. So that's the extent of the updates.
Any questions on this item? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next is item L, review and approve updated CMH MCO policy 10-460 password management. Take a motion to approve. Motion from Chris, support from Joan.
This policy updates the password requirements for our internal systems. It does not include our electronic medical record that's managed by our vendor, and so they set the standards for that. But it involves all of our internal security as far as electronic management of information.
Any questions or comments? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next is item M, review and approve updated CMH MCO policy 10-410 security overview. Motion from Nick, support from Selena.
This policy is updated just to specifically designate the name of our HIPAA security officer, and that's added as an attachment. So if it ever changes, it can be easily changed without having to update the whole policy. It was a requirement, well, not a requirement, a suggestion from our HIPAA risk assessment audit. So we implemented that.
Questions or comments on this one? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes.
Thank you.
Thanks, Kim. Next is item N, request to approve new statement of work from AFIA for continuation of the CMH data warehouse project. Motion to approve. Motion from Joan. Support from Selena. Jim, you want to talk about this one?
Yes, thank you. This is a request for a approval of a statement of work that extends our data warehouse and data management project with AFIA. The proposal that you have in your packet provides a brief overview of AFIA and their process for implementing projects like this, what kind of workflow they go through in order to assist organizations they work with in achieving their goals related to data. With regard to this particular statement of work, on page, I guess it's 161 of the packet, you have the statement of work that identifies the deliverables. They're identified as the charter and project plan for each project area. That's something new with this particular portion of the project. It assigns responsibility and helps us improve accountability from both sides in terms of making sure that the pieces of work that need to be done behind the scenes, outside of the work that we do together, is accomplished on a timely basis. So we make sure that we assign appropriate parties to complete the work, especially at CMH, and make sure that we stay on our timeline. We're trying to really tighten up our implementation and work to move forward on this project so we can accomplish everything we hope to accomplish under this project. Also includes a optimization plan, monitoring plan, and both of those are to look at the data that we've already been able to develop through this project and then make the best use of that data. They're going to work with us to identify key data elements and features within the dashboards that will allow us to receive that data on a more passive basis, so we don't necessarily have to go out and look for the data and say, oh, look at this, our length of stay has crept up beyond a certain point. They have what they call pulses within the dashboard. So if our average length of stay reaches 7.1 and we want to know when it exceeds 7, it will send an email to identify folks so that we can identify very quickly that one of our data elements is getting out of the range where we're comfortable with and where we want to see it. So this plan that will be part of this project will help us to identify those areas that are key areas for us to be looking at and monitoring on a regular basis and put those automated pieces in place that the dashboard allows us to do. Also technical requirements documents and the actual dashboard development itself. We have and I meant to attach it to the statement of work, but I didn't. We have a list that we've received from them in terms of the dashboards that have been developed so far, and we have major areas in hospitalization and our open access process where dashboards have been developed, and a number of sub-dashboards that provide us information regarding people coming into our system and people receiving services through hospitalization. And as you might recall from our last quarterly report, we were able to look at services by CPT code and see how many consumers are receiving what services in what environments. Within this project, that will only continue to expand. We'll be able to expand to other service locations, what codes are being provided by those locations, in what kind of quantities, and we're also working to attach costs to that. One of the things that when we sat down to say, okay, what are we going to work on for this portion of the project, there were more than two, but two of the main pieces that we talked about that are new for this area is looking at value-based contracting. What kind of elements can we look at in order to better track and understand the outcomes we're getting from service providers and be able to attach value to those and develop contracts that say, okay, if you achieve X, Y, and Z, we'll pay you A. If you don't achieve X, Y, and Z, we're going to pay you something less than A. So it'll give us some additional monitoring capability as well as an ability to implement a contract that says we're going to pay you for outcomes as opposed to just providing the service. The other major piece is the ability to attach costs to this, which will allow us to better project our budget categories, and that's something that I know that the board has been interested in. We're interested in it from a management standpoint, is to be able to better understand where we are at any given point in time in relation to our budget expenditures. And once we attach costs to these data elements, we'll be able to start identifying, okay, what's our maximum exposure based on authorizations. Based on historical data, we'll be able to look back and say, X percentage of our authorizations turn into claims, and we'll be much better positioned to predict what our potential exposure is for any given budget report. So those are two main areas that we're going to be looking at working on with this. We're also looking at evidence-based practices, which is, just as it sounds, it's a treatment technology that is empirically based, that there are expected to be outcomes based on the services that are provided. So we're looking at developing a dashboard that will allow us to track if somebody is maintaining fidelity to those evidence-based practices, and if they are they achieving the outcomes that they're expected to get for what we're paying for that service. Okay, so that's the highlights, really. Are there any questions?
I think there's going to be a few. Jim, I'm going to start. The total here is $217,000-ish, we'll say.
Yes.
Where's that money coming from? Is that general fund? Is that?
It would be a combination of federal, general fund and Medicaid dollars. Basically, for something like this, we would take the percentage of Medicaid consumers and the percentage of general fund consumers and basically split that cost
Okay.
Across a contract like this.
Okay, and then last question before I turn it over to Nick. Return on investment, what do you expect to see, I guess? Is there an estimate on, if we're spending this money, is that what we could be getting back? Is it just a general estimate,
Right.
obviously?
It would be hard to attach an actual number to that, but if you remember the first two reports that we did, we were able to identify that, and we would expect to continue to do that, to provide a quarterly report and attach a return on investment. I'd hate to go out on a limb and predict a number.
That's fine. Thank
I
you,
know
Jim.
I wouldn't be right, no matter what I said.
Thanks, Jim. Nick?
You can go out on a limb now because by then you'll have been retired. Jim, just real quick, the hourly rates, this is the second year of the contract, right, with FDA?
It's the second year under this particular, the data warehouse contract. We've been working with FIA for a number of years,
Right.
but yes, this is the second year under this.
So when I look at these hourly rates, what are they versus the current contract? Are they higher, lower, same?
I believe they're the same. I can double check on that.
Well, that's kind of an important point. Because this contract is basically a fee-for-service contract. The 217,000 is an estimate, but they bill us on an hourly basis based on these fees. So my next question was going to be, last year we did the same thing. Did we exceed or not exceed? How close were we to the estimated total when we got to the actual fees for services? And are we increasing? And I thought we were from a prior discussion, maybe I'm wrong, the number of hours or the number of services they were to provide, which would increase the number of hours.
Right. This contract, this statement of work, represents a lesser number of hours than the previous contract.
Projected hours.
Yes, contracted hours, right. We're not obligated to that total amount. It'll be based, on what we spend in terms of the hourly rates. But for the current contract, and it's not done yet, so I can't tell you exactly, where we'll end up. But as of last month when we did the report, we were under the contract amount and expect that we will come under the contract amount that was previously identified.
Okay, so what you're telling me is based on past, we're assuming less hours because there's less business? I mean.
Because so much of the
startup-
infrastructure is already built.
From
Now,
first to second
we're
year.
adding detail onto the infrastructure now.
Good. And we're anticipating fewer hours, and that's what the total is based on, the last few hours. But you can't tell me whether there's been any change in the rates? Because we're paying by the hour based on who provides the services. And that's the only thing that really counts at the bottom line in terms of what the cost will be.
Right. I don't believe there's a change. I will verify that before the full board and make sure that I have that information available.
Okay, thank you.
Jim, could you send that around to the board members before full board so we can take a look at it?
Yep.
Thank you, Jim. Any other questions or comments? All right, seeing none, we have a motion and support. All in favor of moving to full board signify by saying aye.
Aye.
Aye. All opposed? Motion passes. Thanks, Jim.
Thank you.
All right, next is receive and file. We have nothing to receive and file. We'll move on to resolutions. There's no resolutions yet. Jim's still here. Next is other agenda items. Any other members of the board have any? Joan?
Yes, I did pass out to you this Crossroad Putt-Putt Golf benefit. So it's just putt-putt, at JR's. Last year we had this, and we made $2,000, which was good. A lot of people buy tickets and don't come, but it's fun, and if you win, you lose, you get prizes, little prizes. I think they're having hot dogs and pop and chips. So think about it. And if you can't come, you still can donate. So I may check out to Crossroads. And I think we'll be taking up a collection too for a pack. We usually, Serena, she donates 2 tickets for the Red Wings. And that's a good donation. And we just collect, I think, $5 or $10 and buy some Red Wings trinkets to put in. And I think we do it at the May coming, June coming. No, we do it in the winter, in the fall. So you have time to figure if I am going to take 5 or 10. So that's it. Thank you.
Thank you, Joan. Any other board members have anything before I turn it over to Dave? All right, Dave, go ahead.
Good evening. Just so I don't forget, and Lynn, you're going to have to help me out here because I don't have my calendar open. But to pick on Jim a little bit, we are having a very sad retirement party for Mr. Losi. The end of this month on the 27th? May 30th. From 2 to 4. He wanted to keep it kind of low-key, but feel free to embarrass him openly, I guess, at that event or before. Also, this Friday morning, there's a board study session. It's a closed session regarding the residential services. That's at our administration office. As follow-up to the board meeting from last month, I'm filling the spots on the task force. We're currently still looking for some primary and secondary consumers, reaching out to those folks, and then we'll be scheduling those. Next Friday, Milliman, who sets our Medicaid capitation rates, will actually be out on site for the full day, so we're going to load them up with all of our questions. The folks from AFIA are going to be present as well, so we can get our data folks talking directly to each other. And another update, Jim mentioned value-based contracting. The Community Mental Health Association of Michigan has developed a 8-month project for community mental health providers and staff. They're looking for a 5-person team or a 10-person team if you include providers, but we're looking at having a 5-person team attend that those study sessions over that 8-month period. Kimberly Cope and Christina Mozella have graciously volunteered, and they will be recruiting the other 3, so watch out, everybody else. And those are my updates for tonight. Thank you.
Kim was smiling back there. I think it's because she has the power to pick people. Any other items from board members? All right, seeing none, we'll move on to hearing of the public. Anybody from the public wishing to speak? Anyone from the public wishing to speak? Going once? Going twice? All right, we will close hearing of the public. With that, I'll take a motion to adjourn. Motion from Nick, support from Chris. All in favor?
Aye.
Aye. We are adjourned. Thank you, everyone.
He's getting good at this.